Somebody sent me an article recently, and it was about the designer drug Ozempic and how anybody and everybody that can afford it is complaining about it, criticizing other people's use of it, but they're also tending to get a little bit thinner. This is an article, once weekly Semaglutide in adults with overweight or obesity. Here's a quick, easy, and inexpensive way to learn how to save your life by learning more than your doctors told you, and maybe more than your doctor knows. It was in the #1 journal of medicine, unless you want to argue that Nature Medicine is bigger. It's not as well known. New England Journal, last year, United States, looking at Ozempic. 1961, non-diabetic subjects were enrolled in this study. Now, here's one of the questions that somebody like me and you should have. Well, how many of those folks were actually undiagnosed diabetics, and how many of those were insulin resistant, but maybe not full diabetic? I suspect a large part of them. Just knowing our statistics, by the time you're age 30, over half of us have that. And we didn't talk about the age group, but this was more of a middle-aged group. Anyhow, they compared 68-week treatment of semaglutide, Ozempic, Rybelsus, Wegovy, or a placebo. And you're saying, again, doc, you're focusing too much on drugs and not enough on lifestyle. They did the same lifestyle intervention with both groups. The mean change in body weight from baseline was 15% or 14.9% in the semaglutide group as compared with 2.4% with placebo. So think about that. Ken Berry, all the other standard bearers for let's do it naturally. And I've been one as well and remain one. I mentioned earlier on that I had an example of somebody who was taking these medications for 2 years and didn't lose weight. He really actually overcame something, because the bottom line is this: you do with the same lifestyle changes, you get what? 6 times the impact with the addition of semaglutide or Ozempic, Wegovy, Rybelsus. More participants in the semaglutide group achieve weight reduction of 5% or more. And obviously, guess who funded it? The group that makes it. And, I know there will be haters for that, just like there are haters for any other facts that you report on social media. Now let's go back and talk about Tirzepatide. That's the one that we reported on a couple of months ago. Again, it was even far more powerful than semaglutide. Also, New England Journal this year, study groups in the United States, UK, Canada, Japan, and Brazil. This was called the SURMOUNT-1 trial. And remember, the medication is now called Mounjaro. 2,539 adults were included. Tirzepatide or Mounjaro was given once weekly. It was compared to placebo for 72 weeks for weight loss. 85% of patients showed at least 5% body weight loss, and 57% lost up to 20% of their body weight with Tirzepatide. So again, this is body weight along the vertical. This is what people lost with placebo. And yes, there were some lifestyle components. And this is what people lost with 5 milligrams of Tirzepatide. This is what they lost with 10, and this is what they lost with 15. So as you begin to look at the details on that, what would most reasonable folks say? Well, you could use 5 milligrams. You do get an increased impact with 10, but you really don't get that much of an increase beyond the 10. Another Tirzepatide trial, another one in the New England Journal. It was last year, 2021, United Kingdom, UK, US, and Argentina. This time with 1,879 patients, Tirzepatide was compared versus semaglutide for type 2 diabetes control. This wasn't specifically to weight loss like the SURMOUNT trial was. This was more focused on diabetes control. After 40 weeks, Tirzepatide decreased hemoglobin A1C more effectively than semaglutide. And yes, they did look at weight loss, and it was significantly beyond what you saw with semaglutide or Ozempic. So, yeah, we covered a whole lot about drugs today. We covered drugs begun to be very popular in terms of their ability to help with weight loss. I expect to get a whole bunch of hater comments on that. But the reality is the reality. These drugs are saving lives. And again, if you were a physician like me and you were seeing people with heart attack and stroke risk, and you saw the impact of weight loss on, or weight gain on, insulin resistance, prediabetes, diabetes, and you knew the impact of prediabetes, insulin resistance, diabetes on heart attack and stroke, cardiovascular risk, these things would make a heck of a lot of sense. Criticize it or not.